Yeah. All right. Welcome, everyone. Please feel free, if you haven't already, to put your organization name and your location and your preferred pronouns in the chat. And we're going to go ahead and get started. Everybody, please make sure that your Zoom is on mute. And that's down at the bottom left of your screen. There's a little microphone icon. Make sure you have a red line going through that. My name is Tim Joyce. I'm a program specialist at the central office for Runaway and Homeless Youth Program. And I want to welcome everyone to the 2022 Runaway and Homeless Youth Program Maternity Group Home Grant Program Specific Training. And to kick things off, we're going to have some words from the FSBE Associate Commissioner, Kimberly Waller. So I'll hand it to you, Kimberly.
Awesome. Thank you so much, Tim. And great song. Gives me all the feels, as does the movie. So hello, grantees, and welcome, as Tim mentioned, to the 2022 Runaway and Homeless Youth Program Specific Training Series. I'm Kimberly Waller. I'm calling it rejoined the Family and Youth Services Bureau as the Associate Commissioner. I was previously with FSBE as a policy advisor from 2016 to 2018. And during that time, really had the opportunity to learn firsthand the vital importance of our RHY programs and all of the work that you all do to prevent and respond to youth experiencing homelessness. And I'm really excited to be back in this role and am already motivated daily by the impactful and transformative work that you all accomplish every day across our grantee network and within our RHY team. While I have you all, I wanted to take a moment really quickly to share with you some of FSBE's priorities over the coming years. And I have 4 of them that I want to share with you today. And many of these things are priorities that you are doing out in the field and hopefully resonate with you. And really looking forward to doing this work in partnership with you over the coming years. So the first is FSBE believes in the importance of coordination and collaboration efforts across all of our federal, state, and local partners. I think we all know that working together will ultimately allow us to accomplish more than what we could do alone. And I know that you all are doing this on a daily basis in your role as maternity group home grantees. The second is FSBE is committed to ensuring that our work is grounded in equity and inclusion. In February, aligning with Black History Month, FSBE launched an initiative to develop a FSBE Racial Equity Action Plan. We know that you've been engaged in similar efforts within your organizations across the country, and we're really excited to drive this work forward in partnership with you. The third, and again, I know a lot of great examples of grantees already doing this work so well. FSBE will lead in partnership with youth who have lived expertise and who have participated in RHY programs and services, lifting up all voices who have the knowledge and experience to guide FSBE's ongoing work to address and respond to homelessness and housing instability is truly our path forward to finding solutions. And then lastly, FSBE will drive our work using a data-driven decision-making approach. Policy development and programming must be influenced by data outcomes. Services should be responsive to the needs of our communities, of course. And importantly, we should be tracking outcomes that are working really well to highlight that and rethink what we may need to change and think differently about. So again, just kind of wanted to share those 4 while I have you. And then, of course, have the privilege of welcoming you today to this great opportunity to develop new knowledge and skills for developing RHY programming. We have a really great lineup of presenters and sessions, and our time today is structured to provide a balance between presentations. One of my favorite things about these opportunities is, of course, grantee spotlights, giving you all the opportunity to share what you all are doing in the community, and it's really great to share amongst this group. And then, of course, there'll be some great some group breakout sessions throughout the day. And although, of course, this training is virtual, we really encourage you to be active participants in our training activities. There's the chat function and lots of opportunities to engage throughout the afternoon. So these training sessions provide an opportunity for each of you to share your newfound knowledge with your colleagues. Take what you've learned today and bring it back to you for those who may not be able to be in attendance this afternoon. And really, ultimately, this will result in our program participants becoming the greatest benefactors of our collective efforts here today. To, of course, take a moment to recognize our RHY training and technical assistance partner, Youth Collaboratory, for their partnership and expertise in hosting these sessions. There's a lot of work that goes into planning and logistics of an event like this, and we're very appreciative for you and your work. And in addition, I'd like to extend my very big thank you to all of our grantees for taking time today, and to our amazing RHY team for their work in coordinating and planning this event. Your compassion, dedication, and commitment continue to have a lasting and positive impact on young people's lives. Once again, thank you for your time, your commitment, and your dedication to the communities and youth that you serve. And I will kick it back over to Tim, and he will go through the agenda for today. Enjoy.
Thank you so much, Kimberly. We're really grateful for your support and participation today. So if you haven't already, please go ahead and introduce yourself in the chat. We can go to the next slide. We're going to kick things off with a couple of quick polls. First, we'd like to know which region you're located in. So you can, if you don't know your region, you can find your state on this list here. And go ahead and let us know. We've been getting a lot of Region 5 representation in the last few trainings. We want to see who's really showing up this week. So if you can go ahead and take a moment to answer that. Look at that, Region 5 takes it again. So looks like besides that, we have somewhat of an even spread. We have another poll question to ask about how much experience each of you has working at an MGH program. You can go ahead and answer that question. That'd be great. Wow, so we have a great deal of experience here. That's great. Really, really encouraging to see. Thanks everybody for your participation. And also I'd like to say too, I mean, we have this great representation, and to remember that this training it's a training first and foremost, but this is also a networking event. Y'all are doing the same work, just in different places. But a lot of folks probably experience the same successes and the same challenges. So please make sure to feel free to connect with each other in the chat or direct message. And you remember that, after this training too, the RhyTech's community of practice is also a great way to connect with other grantees, and information about the communities of practice we posted in the chat. We can go to the next slide, please. So we have a bunch of housekeeping items to run through before we keep going. Just please be sure to make sure you're muted throughout the training. This is being recorded. The whole presentation, the chat, everything will be recorded. The slide deck that you see will be made available. It's on the RhyTech website, and you'll receive an email from RhyTech after the training with a link directly to the slide deck. And then a recording of the entire training will be available on RhyTech's e-learning platform on the 30th of March. So if you missed something, or if you didn't get to take a screen grab in time, or you didn't write something down, don't sweat it. You'll get all this information after the training. Closed caption is available on this training. So if you look towards the bottom of your screen, there'll be a button that says CC. If you click on that, that'll give live captions as folks are speaking, if you're so inclined. And you'll also, throughout the presentation, you'll see some resources linked on some of the slides. Those links will be made in real time. They'll be made available in the chat. So if there's any resources you want to click on to explore more, you can go ahead and do that. And the chat will be monitored by my federal colleagues from the MGH working group, as well as by the RhyTech team throughout the training. So please enter any questions, comments, anything like that. You can put that in the chat. And they'll be answered as quickly as possible. And some of those we may even get to discuss as a whole group. And like I said, the chat is being recorded. And so if anything doesn't get answered today, we can still get back to you at a later date. And one last reminder is that we will be taking a break before the breakout sessions. Please do not log off of Zoom during that break. Please just leave your Zoom window open, and you can turn your camera off if you need to, but please leave the window open. We can go to the next slide. So the agenda for today, you'll see that we're going to be doing a deep dive into the MGH program today. We're going to be meeting with some of your fellow MGH grantees that are doing amazing work with youth all over the country. We're going to take a short break around 2:30, and then we'll get back together to meet in smaller breakout groups so y'all can connect with each other and discuss what's working well in your programs and what challenges you're facing, things like that. After the breakouts, we're going to meet again together as a larger group and briefly report out. And Rhy will give you some information about doing an evaluation of this training, and then we'll have some closing remarks from RHY's director, Dr. Sanzana Dean. Next slide, please. So let's jump in. The primary goal of the MGH program is to promote long-term economic independence and stability to ensure the well-being of youth and young families through supportive services. And our vision is to successfully transition pregnant and parenting youth who are experiencing homelessness into adulthood through the promotion of self-sufficient living, financial independence, and the prevention of housing instability. Next slide, please. Maternity group home program grants are made for the purpose of providing safe and stable community-based transitional living arrangements that provide pregnant or parenting youth and their children with a supportive and supervised living arrangement. Maternity group homes promote long-term economic independence for homeless parenting youth and ensure the well-being of their children. Next slide, please. Next, I'll give some background on the Rhy Final Rule. In 2016, FSBE established regulations to improve performance standards and program requirements for Rhy programs, which build upon existing policies. The Final Rule, which is also known as the Rhy Rule, created more solid guidance surrounding aftercare, other protections for youth, and statutory changes to the Rhy Act. All Rhy grantees must comply with the requirements of the Rhy Rule. Next slide, please. So next we'll go through some kind of key MGH related terms that are going to be used during this training. Some of these definitions come directly from the Rhy Act, and some come from the regs, and then others are formed for the purpose of funding announcements. Next slide, please. So what is a maternity group home? A maternity group home, which we call MGH, is a community-based adult supervised transitional living arrangement at which client oversight is provided on site or on call 24/7. MGHs must provide pregnant and parenting youth and their children with a supportive environment which teaches parenting skills, family budgeting, health and nutrition, and other life skills to promote long-term economic independence and ensure the well-being of the children. A transitional living youth project, or TLP, provides safe and stable shelter and supportive services to youth to promote a transition to self-supportive living and prevent long-term dependency on social services. Next slide, please. For the purposes of this MGH training, a homeless youth is an individual of the ages of 16 to 21 who has no safe living environment or arrangement. The age limit of 22 is flexible in certain circumstances in which a client enters the program under the age of 22, but is unable to complete the MGH program prior to turning 22. And in cases like that, you definitely want to consult your project officer. Next slide, please. Per the Rhy rule, a client is a runaway, homeless, or street youth, or a youth who is at risk of running away or becoming homeless, who is served by an Rhy program grantee. The term services encompasses a comprehensive youth-centered services model with a holistic approach to addressing the unique needs of MGH clients and their children. Beyond shelter and safe and stable housing, services includes gateway services, assessments, case management, aftercare services, external provider linkages, information and referrals for life skills, counseling, parenting, interpersonal skill building, educational advancement, job attainment skills, and mental and physical health care. Next slide, please. And healthcare services refers to physical, mental, behavioral, and dental services, which an MGH client or a client's infant or child receives or is referred to. Next slide, please. Screening and assessment refers to valid and reliable standardized, standardized instruments and practices used to identify each client's individual strengths and needs across multiple aspects of health, well-being, and behavior in order to inform appropriate service decisions and provide a baseline for monitoring outcomes during their time in the program. Screening is used to determine whether more thorough diagnostic assessments and services are required. Assessments are not meant to diagnose, but rather to inform service decisions and monitor outcomes. Screenings and assessments will be addressed thoroughly later in this training. Next slide, please. A couple more. Host home is a family or single adult home that provides stable housing to an MGH client and their children, as opposed to a group or scattered site setting. And finally, follow-up services refers to monitoring client progress after they have received safety and resource aftercare referrals after exiting the housing or shelter portion of the MGH program. So next, my colleague in Region 5, Danielle Taylor, is going to begin our overview of project requirements. Danielle.
Thank you so much, Tim. Hi, everyone. Thank you so much for being here with us today at the Maternity Group Home Program Training. My name is Danielle Taylor. I am a Youth Program Specialist or Federal Project Officer in Region 5, working with the states of Ohio and Indiana. As Tim mentioned, our next segment will cover the project requirements. Next slide. Oh, there it is. Within the project requirements, it is important to note that all MGH projects must provide shelter and supportive services. You must provide both, and neither are optional. The primary project requirements for MGH include safe, stable, and appropriate shelter, a comprehensive youth-centered services model, and sustainability plans. So without further ado, I will pass you along to my esteemed colleague, Jessica. Jessica, go ahead.
Off to a great start. I was on mute. Hi, everybody. Good afternoon and good morning. To those of you who are on a, or in a different time zone. So my name is Jessica Drazonovich, and I'm a federal project officer. I work with runaway homeless youth grantees here in Region 1 in Boston. So I have the pleasure of working with runaway homeless youth programs in New England. And so that covers Maine, New Hampshire, Vermont, Massachusetts, Connecticut, and Rhode Island. So shout out to the programs up here. You guys are doing really great work. And so as Danielle had indicated, I'm here to talk about safe, stable, and appropriate shelter, specifically in the maternity group home context. So, and I really want to highlight, before I get into this discussion here, I just want to highlight what Danielle said in terms of shelter and supportive services. So a really core component of the maternity group home is providing that shelter piece, right? And so it's about housing. And then of course the supportive services along with that, but the housing piece is vital. And so keep that in mind. I know that programs that already exist as MGH, you know that, but for future programs, if you're considering starting an MGH, that's really a core component. And so choosing, supportive services or housing, it's not an option. You really need to have, it's an absolute requirement to have that housing piece along with the supportive services. So, so for this slide, in terms of this requirement, so all MGH projects must provide a transitional living arrangement for pregnant or parenting youth ages 16 to 21 who are experiencing homelessness and their children for up to 540 consecutive days, with some exceptions. And so what we mean by those exceptions is just in exceptional circumstances, the programs can provide up until 635 days. And those exceptional circumstances, that's really something that should be discussed with your federal project officer. That's not something that is very common. And so in those exceptional circumstances, where you're looking at and you may need, you see that, perhaps the youth needs a longer time in the program, again, discuss that immediately with your federal project officer. And so in addition to that, there are circumstances where youth who are in the maternity group home programs have not reached 18 years of age, and they're reaching the last day of the 635-day period. And so they may remain, and if they're otherwise qualified for the program, they may remain in the program until their 18th birthday. And so in addition to that, when youth, are approaching the maternity group home program, and if that maternity group home program at that moment doesn't have an opening for that young person, and their child, if they don't have that opening, then the MGH program has to have some sort of linkage with a local youth emergency shelter that's age appropriate, so that, that shelter can accommodate that youth in the case where there's not, that opening, and the youth will at least have some place to go for emergency shelter. In the meantime, if the MGH is looking to, is, trying to look to make, other arrangements, or if there's, wait lists that's possible for the MGH, or if they're just having to look, for other options overall for that young person or for the young family. So next slide, please. And so MGH housing facilities have to have a ratio of staff that is sufficient to ensure youth and their dependent children receive adequate supervision and services. So when we say that ratio of staff to youth, that's not something that FISB determines or dictates to you all. That's something up to the agency, kind of based on your staffing and youth, up to, again, that's something that, you all determine kind of based on your space, based on the conversations you're having with your state. That's not something that, again, we're micromanaging or telling you all. It's just that, you need to have this piece in place. And, and so then when we're kind of doing reviews, of these housing facilities, we need to see that there is that adequate supervision so that each and every one of the youth, and their children that are in the facility are receiving the adequate supervision and all of those supportive services that are required as a part of the maternity group home program. And so those individual facilities, those housing facilities, if they're the facilities that are, the housing options, so congregate care facilities, they have to have the capacity to accommodate at least 4 youth, but no more than 20 individuals. So this includes youth and their children, in the facility, but that does not include staff who may live, in the facility, as we see sometimes. And so can we move to the next slide, please? Okay, so we're actually going to get started with a poll. So just really quickly, what sort of housing does your MGH provide? So if you can answer, we have a shelter, single site housing program, scattered apartments, or host homes. Oh, wow. Okay. 58% shelter, single site housing, scattered apartments, very small percentage of host homes. Okay. Okay. Very interesting. Very interesting. Yeah. I've seen a lot of really neat, models out there for on-site visits, for MGH programs. I have not seen a lot of host home models. So that's definitely something that, if you all have, any, for those of you that had those host home models, if you could drop, experiences or just, more information about those models in the chat, I know that other folks, probably be interested in learning more about that, just managing that at the, the MGH sort of level, for that housing. So an MGH site can be, as I mentioned before, it can be a single site with multiple clients. It can be a host home. an individual scattered site, and also the supervision plan has to be provided. And so also kind of a key component here within the housing that's provided, each youth and infant or child, they must have their own bed in the parents' room. And so next slide. Okay, thank you. And so actually to close out this section, we are going to have another poll. So is your MGH program located in an urban area, suburban area, or a rural area? Okay. An urban area. Okay, majority. Interesting. Okay, great. Thank you so much for the responses. And okay, so I am actually going to pass it back to my awesome colleague, Danielle.
Thank you, Jessica. Next up, we have the comprehensive youth services model, and Nikki Lee is going to share some information with you, as well as some of your peers in the MGH world. You'll get to hear directly from them. So Nikki Lee.
Thanks, Danielle. Hi, everybody. My name is Miss Nikki Lee. I am a federal program officer in Region 5, Chicago, and I oversee the state of Michigan. I'm so happy that all of you all are here. We have a good attendance because we have a lot of useful information to share with you all. I am going to be focusing on comprehensive youth services model. And before I start, sorry that I have to wear the mask, but I'm not in my regular home office, and there are other people kind of passing through. But I wore this jacket for you, everybody, so that would kind of offset not being able to see my mouth move. Okay, next slide. In the comprehensive youth services model component, FISBE is always looking for how programs are weaving this thread of the 4 outcomes, such as social emotional well-being, stable housing, education and employment, permanent connections throughout the program services. And FISBE is really looking for programs to do all they can to facilitate their clients, the family, their child, to moving to self-resiliency and independent and sustainable living. So hopefully they will never need the services of an MGH program or any of our programs ever again as they move forward in life. FISBE is always looking, and it is required that the program have trauma-informed approaches and positive youth development. That framework woven throughout their programs so that youth have an opportunity to feel as though they have a voice and what kind of comprehensive services they will receive, as well as if there are things that are missing or they think would be beneficial to add to the program to help them, that the program will hear that and incorporate that into their program services. And it also develops their leadership skills and gives them an opportunity to just demonstrate the life skills that they are learning and actually apply them, not just learn them in theory, but also practice them. The trauma-informed approach is extremely important, and it has to be woven throughout the various program services. Also, FISBE is always interested in programs, always using evidence-based approaches so that it's tried and true, and it's something that can be used across programs. Next slide. In conducting outreach, it's here on the actual slide. It's conducting outreach directly to pregnant and parenting youth and young adults in the community where they're at, so that they know about the program services that are available to them and that can assist them as they move forward throughout their pregnancy. And it's really to provide it directly to them and find them, identify them, and hopefully enroll them into your program. And then in terms of education and awareness, that is more about when you go out to entities in the community, be it law enforcement agencies, faith-based organizations, school districts, any of the youth serving entities in the community, and even those that might not be so youth services specific, but they see youth, they know of youth, they can pass the word on and tell different youth about and young adults about your program. So they act as an extension of your staff, and also they're partners of yours that you have identified that definitely saturate the community with information about the work that you all do. Next slide. In terms of youth engagement and collaboration, programs are required to oh, hold on 1 second, sorry. What are we doing? Are required to engage youth with lived expertise to assist in locating youth, developing youth-centered services and outreach strategies that are individualized to meet the youth's needs, and ensure education and awareness strategies are grounded in youth voice and collaboration. And that kind of just goes back to the positive youth development strategies that have to be incorporated in the program, so that youth can feel as though they have ownership of the program. It's not just services that are being provided to them without even, inquiring what they actually need, but that they know that these services are definitely individualized and directed to their individual needs. In terms of provision of basic needs and gateway services, the program has to be able to provide different things or products to the youth and young adults that they serve, such as food, drink, clothing, personal safety information, transportation, hygiene products, and in the case of an MGH program, even having diapers or baby wipes and things like that, that definitely speak to the pregnant and parenting youth and young adult population. Next slide. Programs are responsible for having screening and assessment tools that absolutely assess the youth's eligibility, and even screening and assessment tools that address the youth and young adult's child, so that they can assess where they're at coming into the program and what their needs are, develop a written plan that provides all of the information that they will need while participating in their life skills. If there's a need for continual education or reconnecting to education, employment services, childcare, all of that will be identified through those RHY screening and assessment toolkits. And by the way, I didn't say it before, but all of the links that you see, if you click on any of those when you get your PowerPoint presentation, you will be able to click on those links and see a whole host of resources and information. And I always like to also ask programs to bookmark or definitely keep these other websites handy. One is RhyTag, which is our TNTA provider, and they are one of the most important partners we have because their website has a host of trainings, the RHY required trainings that you have to make sure staff have annually, as well as the National Runaway Safe Line, which has all kinds of trainings and resources at their website, and National Clearinghouse for Youth, youth.gov. And I always recommend, while you're at it, even look at the partnering divisions of the government that provide some of the services that we provide to programs, but also they will speak to the youth and young adults needs in your program, such as Head Start and Early Head Start for childcare and a whole host of other resources. SAMHSA for substance abuse, HRSA for health-related kind of services, the Children's Bureau, because many of your programs also see county youth or youth that are aging out of county services, the Office of Refugee Resettlement. We all know, we look at the news all the time, and many of times in any community, if they're not there already, there will be refugees that will settle in your community. And so familiarizing yourself with all of those needs is so important and crucial. And you can find all of that information at Office of Refugee Resettlement's website. Next slide. Case management. The programs are required to definitely engage in case management, comprehensive and intensive case management, depending on the individual needs of the client they're serving. You can see the required elements such as individualized service or treatment plan, record keeping and case management, not only for the youth or young adult parents, but also for the infants and toddlers. Service coordination plan, a child care plan, a transitional living plan, and aftercare services plan. Next slide. Now, I'm going to introduce you to our first presenter, and that is Tawny Johnson and Laura Peterson from Arizona Youth Partnership. And they will be sharing with you all kinds of ideas and concepts in terms of their approach to conducting case management and record keeping in their program.
Thank you, Nikki. Appreciate that. I'm Laura Pedersen, and I'm the project director for our Starting Out Right for Homeless Parenting Youth program. And we provide a host home program here in Arizona. And we are in 5 different counties, rural and urban. So that answering that question was a little bit difficult for us because we're all over the place. After delivering 22 years of programming for pregnant parenting youth, this is our first MGH contract and our first host home attempt. So we are in year 3. We've developed everything from the ground up, along with using some of those great assessments Nikki just mentioned. We did launch our recruitment of host homes 2 years ago. The same month, everything shut down with COVID. So we were hit with a lot of challenges, but we've also had a lot of successes. And one of those successes is really developing an amazing process to track our families, track the work we're doing with our young moms, as well as our infants and toddlers. So just being able to show you guys how we support our infants and our toddlers. I'm going to hand this off to our amazing host home case manager, Tawny Johnson, who is going to walk you through all of the steps that she has been using to reach great success with the families that we've served. So Tawny, take it away.
Thank you, Laura. Hi, everybody. I'm Tawny Johnson. I am in rural Arizona. I'm smack dab in the middle of Arizona in Payson. And I have case managed for our rural county here in Gila County. And I do want to reiterate what Nikki said about bookmarking those assessments and all of those RHY resources, because those were essential in really developing these client forms that we have used to case manage not only our youth, but their children as well. So as I walk us through these slides, keep in mind when I refer to the youth, I'm referring to our clients, the parents that are coming into our program, and their child, either the babies or the children that they bring into the program as well. Because there is a lot of documentation for our clients, our youth that come into the program, but we're going to focus on that case management for the infants and toddlers and how we document and track their time in our program. So go ahead to the next slide, please. We have developed these forms and these documents to really capture all of that information, our client data, but also our interactions with our clients and their children. So we start by collecting that basic information upon enrollment. Most of our clients start in our Starting Out Right program, the Pregnant and Parenting program for youth. And during that initial needs assessment is where we identify if they are at risk for homelessness or if they are eligible for our host home program. So we have our child file here that really kind of walks us through those initial documents that we need. And this is done upon enrollment, or if they come into our program pregnant, then after delivery. And all of these forms here, their intake, their consents, they are scanned and put into their electronic files with their parents folder. And if you see at the bottom of that slide, that's just a reminder for us as case managers, how we manage these documents. All of the child's files go into their parents' files as well. So that's how we're able to kind of manage those many, many documents that we collect throughout our case management with our clients and their children. All of these are scanned into their electronic file and locked in a locked filing cabinet. We keep those originals and hold on to them so that we have easy access to them. And for our clients, if they come in and they need a copy of their documents, we have them easily accessible. And then next slide, please. So we maintain track of all of those files through our child visit file. And these are updated, as those program logs are updated that we'll talk about. But these forms are completed as they come in. And some of them have to be done as soon as possible. Those medical and transportation consents should be done right away, especially if we have the host home caregivers or the case managers transporting our youth and their child back and forth, especially from the hospital to home, to doctor's appointments. We remind our host home caregivers to keep those consents in their car, wherever they're taking their client. And then the case managers, we keep them in our home visiting file. So we have them every time we go if we need to pick up our client. And our program file, our child visit file, it houses where we document the programming that we provide to our youth and their children. So ASQs, those ages and stages questionnaires that we screen our youth and their children with, those are documented here. We also want to work on that discharge planning summary as soon as possible. It's unrealistic to think you could get it all done in one day, especially if you're moving a client into a home. There's so many consents that need to be done right away. And this discharge planning can be a little daunting for our youth sometimes, especially if they've moved around a lot, which most of our clients have. They tend to move around a lot. When I brought this up with my last client, she told me, she's like, that makes me sad having to think about leaving and planning to leave and move out. So really approach this discharge planning with a positive outlook. It's empowering our youth to plan for their future. Because as case managers, that's our main role, is to really help our youth plan for their future. We're always planning and trying to be one step ahead and guiding them to be able to plan for their future and set goals. So when it comes to that discharge planning, it's a necessary document, but it can be a little scary. So get it done right away and just remind your youth that, this is we're planning for our next step, for our next season of life, and we're transitioning. And then, we record those dates there, we initial them so that we can keep track of all of those documents that we have. Next slide, please. And then we record everything, because as our director has reminded us many times, if it's not documented, it didn't happen. And that's true with all case management. If we didn't document the interactions for the data, then it didn't happen. And sometimes as case managers, we tend to feel like data collectors. We're collecting so much data all the time, as these documents show. And so we record this data and these dates and the collection of this data in our child visit file. And there's one file per child. So if your youth comes in with more than one child, then we have more than one file one file per child. These are also scanned in electronically, and we hold on to those originals. Let me move on to my next one. Here we really house all of the services that we provided to our client and their youth. So not just the screenings and the assessments, but their well child visits, when they've gone to the doctor, those dental screenings, the immunizations. And we take this time to really step away from that data collector position and jump into our case management role. And with COVID the last couple of years, you know, there are times where you can't meet in person and you're doing virtual or over the phone. And so we want to make sure that when it comes to this case management, especially when we're talking about their child's care plan and how their doctor's appointments are going, we really want to get a comprehensive look at that and take the time to have that conversation about how important it is to schedule those well child visits, keeping track of their immunizations and their dental records, trying not to just get caught up in collecting that data. What time did you go? What happened at the visit? What did they check? How much did he weigh? What shots did he get? We want to have that conversation with our youth to empower them to manage these well child visits, to manage their child's immunizations on their own, because that's what we're here for. We're preparing them to do this on their own. So we really want to make sure that we can take a minute to, you know, step away from our computer and documenting these dates and really talk to our clients about what was discussed at this visit. Another thing we do is with these ages and stages questionnaires, these screenings, we can score them and see if their child is at risk for developmental delay. And so that's a good time to talk to your client about, you know, was there a concern? Is there a concern? Bring it up to your doctor. And then at every visit, you can go back and look at these dates and record that. But what we do at our organization is we have a really great database that our program has created, the Starting Out Right database, our SOAR database. And that's where we keep all of our clients' information, the pregnant, parenting, our host home clients. And it's a really great tool because it helps us to manage all of those case management notes. So we know that one of our children had a concern in their ASQ, then we can go back and check that note so that our next visit, we know what we're following up with. And it's just a really handy case management tool, but it helps with just continuity of care, because if one case manager leaves and a new one takes their place, they have all of those notes and those records, and they're not having to dig through paper files or a desk to see what happened last. So those case management notes within our database are really helpful. It allows for continuity of care and being able to help our client and their child through their whole journey with us. So that is kind of the gist of the child's case management and record keeping. There's always lots of documentation that comes in with MGH, especially with host homes, because we have our host home caregivers, we have our youth, we have their child, but definitely taking advantage of the resources that RHY has to offer and those assessments and the checklists and being prepared. All of our client files and their child files are ready to go in these pre-packed client packets that we have. So if we're ready to accept a new client as soon as possible, we have a checklist of all of the needed documents. And then of course, our child visit files and our program logs that are really, really helpful. But again, just remembering that we're not just data collectors, we're case managers. We're here to help the whole person and help them move forward and really get to that next step in life. So thank you guys. That's all I have for you.
Next slide. Thank you, Laura and Tawny, for such a great presentation that I'm sure will be beneficial and helpful to all that are in attendance. And of course, your information is on the slide. So if they want to reach out to you to learn more, they certainly can. I saw something in the chat that asked if the slide PowerPoint presentation will be available. From what I'm understanding, it's available now at the RhyTech website, or will be shortly. Also, you will get a separate email that will also have the PowerPoint presentation in it. So, just look for it because it's definitely on the way. In terms of aftercare services and strategies, the final required element of case management is to develop aftercare plans for each youth, young adult, pregnant and parenting client, and for their child or children. It's always encouraged that you start the aftercare plan as early as possible. It will evolve, it will change, it will grow, it will morph into many things. But getting it started with the client's input all along the way is great to do prior to them actually leaving. The aftercare services kick in after the youth has, or family, young adult, youth, pregnant and parenting, youth and young adults have left the program. But there is that connection that proactively the staff at the agency have to initiate. It can't be left to chance of if the youth or young adult calls in and needs something. The program has to have something in place where they regularly reach out to the pregnant and parenting youth or young adult to see if there is anything they can assist them with, some referral services in the community, if there's something that they can identify and assist them with. And unfortunately, even though you've been a good program and provided a lot of services and they really have been connected to you all, sometimes in crisis, they don't think to call you all immediately. So that's why it's so important that the staff proactively reach out to those maternity group home clientele to see if there is anything that they can assist them with. And if not, if they don't need any assistance, that's even better. But who knows? Reach out to them, because those might be your future board members later, or they might want to work in your program. So by all means, do that. It has to be engaged in for at least 3 months. It's always recommended that if you can do it at 30-day intervals at the minimum, 30, 60, 90 days, and then see how far you can carry it out. It's great if you can do it for 180 days or beyond, but definitely reaching out to them. Next slide. Now we're going to hear from someone that I actually used to work with, or I used to work with their program, and that's the Bridge for Youth in Minnesota. That's Lakeisha Holman Griffin and Christine Woodley, and their program is called Marlena's Place.
Nikki, thank you. I'm Christina Woodley at the Bridge for Youth, and I'm going to start just to ground us a little bit for those of you who might not know the Bridge, and then I'm going to pass it on to Lakeisha, who's our program director. So the Bridge for Youth, we were started in 1970. We're one of the first emergency shelters in Minnesota and in the entire country. And so for the last over 50 years, we've evolved, we've grown, we've changed, but we've maintained a commitment to meeting the immediate needs of minor age youth and families in crisis. This last fall, we did some strategic planning, a collaborative process, and excited to share, we regrounded ourselves in our mission. Our work is gritty, but it's beautiful. And at the end of the day, our North Star is our mission, vision, and values. And so here at the Bridge, we center youth voice, justice, and equity in all that we do. And we empower youth experiencing homelessness through safe shelter, basic needs, and healthy relationships. Our vision is a community where all youth feel safe, accepted, and supported. And so I shared, we were one of the first emergency shelter programs in the country, and that is still very much a core program of the Bridge, Resilience House. But over the years, we've evolved, we've expanded, we've changed. We've had TLP programs. Today, we now have maternity group home program. We have an emergency shelter, both for unaccompanied youth and parenting minor age youth, affordable housing, street sites, and community-based outreach. But at the core of all of our programs is youth voice and youth choice. We welcome all youth into our programs, and we see this as part of their journey. They're at the Bridge, and so we empower them and support them along the way by giving them the immediate support and stability that they need, but also those long-term resources. And so through that lens, in 2018, we were seeing an increase in minor age youth entering our program who were pregnant or were parenting, and really a lack of resources available. And so we thought really bold. We had some cheerleaders. Nikki Lee, you were part of one of our advisors when we reached out and said, hey, what are we doing? Does this make sense? There's a need. There's a gap. We think we want to do this. And so we thought really bold, and we took a big step, and we opened Marlene's Place. And so with that, I'd like to hand it off to Lakeisha, our program director. Next slide, please. Lakeisha, are you there?
Here we go. Afternoon, my name is Lakeisha Holman Griffin, and I am the program director here at the Bridge for Youth. I'm here to talk about Marlene's Place, which is our maternity group home that is licensed through DHS. Here we serve youth ages 16 to 19 and their child up to age 0 to 3, and partner with another youth serving organization to serve youth ages 20 through 22. Services offered here at the Bridge. We offer an array of services from case management to comprehensive health supports, independent living and parenting education, resource referral, as well as aftercare supports. At the Bridge, we foster the 9 guiding principles of youth work, with journey-oriented being one of those 9 guiding principles. When I think of aftercare at the Bridge for Youth, I think of journey-oriented, which says that youth decide where they want to go and how they want to get there. We begin aftercare planning with youth, as Nikki said, from the very beginning. We planned aftercare, what aftercare will look like, and develop case plans with the youth early and often within their care, so that when it comes to the time of transition, youth feel supported and prepared to transition out of programming. When talking with youth about aftercare needs and what is important to them, youth shared and asked for consistency and also non-judgmental supports. Youth also shared, which was a key learning for us, that it is really critical to get supports early on in that transition. And so once they get into their new environment, everything has settled, having supports is really vital to their continued success. When a family leaves Marlene's Place, we do aftercare contacts at 2 weeks. That is the first time that we reach out. And then we continue aftercare supports up to a year at 1 month, 3, 6, and 9 months, and then that 1 year of check-in. Through general conversations, we are checking in and checking on our youth to learn what they are needing and how we can best support them. We also use the indicator of stabilities checklists, which helps us to in providing those ongoing supportive services and continual of care to the youth. Services often we're learning from youth, or the services that are requested the most often are resource referral. We also use that time to invite youth to any activities that we are having at the Bridge, for instance, our community in the courtyard. We also invite them to any services or supports that we have, like our quarterly dental clinics, as well as encourage them to continue to connect with our on-site mental health therapists, and be involved in our groups that we offer, as well as active engagement on our youth advisory board. When we check in with youth are generally doing well. They're generally doing well. As I said, what is communicated as the most need is that resource referral or supports connecting to system navigation. For instance, I lost my birth certificate. I was born in another state. Can you please help and support me in obtaining another birth certificate? One of the major challenges that we face in providing aftercare to youth is the inability to connect with them when they've had a change in their contact information. And so oftentimes we will lose contact with them, but we will use things like social media. We will reach out to a parent or guardian or a family member to continue to connect with those youth. But that is the greatest challenge that we face. If you allow me, I'll share a success story. We just recently had a youth who transitioned from our maternity group home this past fall, and I will call her T. As I was leaving the Bridge the other day, I ran into another youth who is still in our maternity group home, and through conversation, she had shared that she was connecting with T and that she and T often connected to continue to get their children together, and also just engage in the bond that they've built while being in the maternity group home together. T also continues to check in with our mental health therapist to receive those supports, and also works often with our independent living skills coordinator to continue with those services of independent living supports. And so T will also be speaking or has agreed to speak next month at our Bridge for Youth event on her services and supports that she's received here at the Bridge. And T is an example and many others of what support should look like in connecting, receiving those supports, becoming stable, connecting and building lasting relationships and supports, and then coming back to get the services she needs and also continue fostering those relationships. Thank you. And if you have any questions, please, and I believe in the chat will be a link to the Bridge for You. Thank you.
Thank you all. Thank you, Christina and Lakeisha. Nice to see you all too. Don't be a stranger. Next slide. Okay, now we're going to talk about the child screening and assessment tools and the child care plan that each MGH program must incorporate into the services that they provide. It should promote long-term economic independence in order to ensure the well-being of not just the parent, but the whole family unit, including the children. The child screening assessment tools, MGH projects should implement screening and assessment tools that are evidence-based to monitor the youth or children's development, and they should be developmentally appropriate as well. In terms of the child care plan, the program must link youth to safe, affordable, and accessible child care and early childhood development services so that youth can complete their education and employment goals. Next slide. Programs have to make sure that they incorporate curriculums, services that definitely build on the parenting skills of their clients. It should promote positive parenting practices, opportunities for families to engage in activities that promote, oh gosh, I can't even see it because I have the pictures up, but positive parenting and child bonding and other interactions and support to address parenting challenges and barriers. I had mentioned earlier about the Head Start website and Early Head Start website. You'll find a plethora of information on parenting and other resources that help to help the parent, because they are the first teacher of the child, to help support a healthy development and a healthy relationship with a nurturing relationship with their child or children. Child development projects. Projects must educate clients on observing and assessing appropriate development areas. Again, there's another link, and all of these links that have been mentioned and those that I had mentioned, and I forgot one important one, that's the Family Youth Service Bureau website. Definitely have that bookmarked because there is just so much information in all of these websites, and we're all doing some of the same work. It can help leverage your dollars in terms of training, in terms of resources. There's the opportunity is therefore to build partnerships and get memos of understanding and letters of agreement and support that will help with your, when you're applying for grants and putting forth grant proposals and connecting that whole family unit to everything that is in your geographic location. So really saturating everything and identifying all of those resources so that you can just provide seamless wraparound services to the youth, young adult, and the child well after they graduated from your program. Next slide. Family budgeting and literacy. It is crucial that while youth and young adults are in your program for 18 months, that there is a component in your life skills training that really focuses on family budgeting, because that's where they'll get to practice their skills of saving money, setting aside money for utilities, the overhead costs, groceries, rent, or a mortgage if they're buying a house, which does happen occasionally, right out of a TLP, MGH program. So really looking at all of those things that you can provide them and make sure that your family budgeting piece is very robust. And you can pull from so many areas to pull that piece together. If you find an actual curriculum that has everything that you need, by all means, incorporate that. In terms of health and nutrition, it's extremely crucial that you all make sure that, the child or the pregnant and parenting youth and young adult is eating a healthy diet. They know they're getting through life skills, they're getting training on nutrition and health. And that's everything from well baby checks after the child is born, but also those prenatal, perinatal, and postnatal checks, vaccinations, whatever it might look like, that you all are able to provide them with all of the services, immunizations, what have you, that the child and the parent will need. And USDA is a website that you can visit, and it has all of the information you need for recipes, meal planning, the nutritional value of food, of different foods and vegetables, and all of those kinds of things. So by all means, visit the USDA website. Next slide. Parenting curricula. MGH projects will utilize an evidence-based parenting curricula and materials to assist in providing parent and child outcomes and forming positive parent-child attachment. Again, there's Head Start that shows up again. They do so much of some of the similar work that we do, and many times those Head Start agencies are part of a community action agency, and which also houses LIHEAP for weatherization and utilities assistance and various things like that, Meals on Wheels, various things. And if the parent becomes a member of the governance board, they really have say-so in what's going to be in their youth, what their child will experience in terms of teachers, in terms of food, in terms of toys, playground equipment, and also they can provide GED classes, they can provide counseling services as well. They can even absorb many of the parents into the program as bus aides, kitchen aides, teachers aides. And because they have millions of dollars to fund their programs, if any one of those parents asks to gain their teacher certification, they're required to provide them that training, which gives them another certificate that they can utilize not only in the Head Start program, but in other situations. And it gives them a leg up on, rising above even a living wage. So there's so many opportunities there. It's pregnant with so many possibilities. So I encourage you all to explore them. And most importantly, they definitely have developmentally appropriate childcare. It's safe. It's just what allows the family to move forward, because it allows the parent to continue their education and find gainful employment while knowing that their child is being taken care of in a safe and appropriate manner. Next slide. Okay, and now we're going to hear from Waking the Village, and which will be presented by Bridget Alexander.
Hello, I'm Bridget Alexander, and I am from Waking the Village. Waking the Village is a program. We're an MGH, but we also have a range of other programs. Can we go to the next slide real quick?
Yeah, I should have said that, sorry.
And today, by the way, I'm going to be talking a lot about child assessments and intake processes, but more from the lens of how we can do these in a kind of harm reductive way that's very enriched with trauma informed lens, and also a way to build relationship along the way. So I'll tell you a little bit about us. Waking the Village, we opened on Martin Luther King Day back in 2003. We opened, we're very service rich. And so we have, over the years since we've started, had a lot of different services added. So for example, we have a prevention and intervention program that acts as the front door to services actually in the whole youth housing continuum, even with other partners. And then we move from there into our transitional living programs, MGH. And then we also have a program called the Creation District that houses, it's a art studio with a music label that attracts youth experiencing homelessness. And then from that connection to arts, we start building connections to youth employment programs, to wellness programs, to education programs that we can give credit, high school credit for, and all sorts of other things. We also run 3 licensed preschools and have found through the years that our preschools not only allow us to provide free licensed high quality care to our youth, it also gets us around the long wait lists that often were a delay in connecting youth to preschools. It also generates funding for our programs. And so all 3 of our preschools actually generate funding that we funnel towards our homeless programs. And then we also actually have a program called the Teacher Brigade, where we've been training graduates of our program and residents of our program as preschool teachers. And once they've got the 15 units they need to become teachers, which usually takes about a year, we can start employing them, earning as much as $19, $20 an hour and bringing them immediately into careers. Can I go to the next slide? So at Waking the Village, we really think a lot about trauma-informed care and what it looks like when we're doing processes like intake, which have the potential to be re-traumatizing. And so we've heavily structured our intake process to be all about relationship building. So we're still getting the essential information that we'll find in screenings and this and that, but we're making sure that the conversation is conversational, that our case managers know how to build into that dialogue, questions that get the information they need. We also make sure that the intake isn't just capturing liability-focused information, but also strength-based information. We very much, when we're doing our child intake, are allowing the parent to share their expertise about their own child and to share some of their own theories about parenting. And we're also setting up kind of a fundamental aspect of the way we develop parenting curriculum and develop our parents, which is that parenting is a conversation, and there's many theories. There's many thinkers about it. And everything that we make as a parent, every decision we make as a parent can be made in conversation, that we stay engaged with kind of different theories of parenting. And so we definitely want to share that. We don't want to give a sense that there's only one way to do things. We also take time and make sure we honor parent choice. We know that one of the main ways we transmit culture is in our parenting. And so if we get too bonded down with certain beliefs about how children sleep, how they should be fed, how they should be disciplined, we oftentimes are actually imposing kind of past ideals, or sometimes even like white supremacist kind of centered ideals about what parenting looks like. And so we do try to call attention to that and make sure that we're having heavy discussions. To give like an example of that, our preschools are very play-based. And so our preschools deeply believe that play is a language of children and a way to develop skills. At the same time, sometimes we get parents who've devoted tremendous amount of time to doing their children's hair and sending them to school in beautiful clothes. And when we send them home with their hair all tore up and their clothing covered in paint, that can create a conflict in parenting styles. And rather than make an argument with them that children should be playing and allowed to make mess, we instead take time to understand their kind of cultural views on that and take time to explain our theory and find that middle ground where folks feel well. We also, sorry, I want to check. Oh, there's one other thing too. When we're doing intake with parents, we work really hard to make sure that we're not sitting in front of a screen. And we also make sure that, so we'll take notepad notes. We also make sure that we are sharing the information. So we find that so often we're getting a tremendous amount of information from intake, and then we're putting it somewhere in a folder or a drive or a binder. And we're not sharing that with other folks that work with that family. And so we make sure that we're sharing critical information about the child and the parent with the folks that'll be working with that child and that parent. On the next slide, I'll be sharing some of the questions we actually ask on our child intake. So if I could go to that next slide. Thank you. So yeah, so like I said, we're centering this as a conversation. So we'll ask things like, tell us about the day your child was born. What are things your child loves to do? Who are people your child loves and derives comfort from? Tell us about your child's daily rhythms for meals and bathing and sleep. We ask, does your family co-sleep, or does your child sleep in their own bed? How does your child learn to trust? Tell us about your child's personality. Tell us what your child loves to eat. What are your thoughts on responding to a toddler when they're having a tantrum? What's an experience you'd like to plan with your child this month? These questions create so much more camaraderie. And so often when we take a hard look at our intakes, we're screening people constantly. And we still get in the screenings, but oftentimes you'll find that you can get that same information with a different kind of question that builds a lot more relationship with the client. Can I go to the next slide? Sorry, I wish I had controls on my slides. Sorry about that. So here's elements of our trauma-informed assessment of children. So first off, it's long. Our child assessment is actually done by a graduate of our program who has been working for us for almost, 10 years now, maybe. And she's also trained as a doula. And so she does a whole bunch of, and she also worked for a while in our preschools as a preschool teacher, got her degree, got her ECE credits and does that. And so she's somebody that's tremendous with children, tremendous with parents, and brings this incredible lens, having graduated from our program. And so we're so lucky to have her work with us. And she's the main one that does this. However, we do have case managers that also do these assessments. The first thing is we never do these right away. We have to remember, and I have this point at the bottom, when kids are coming out of homelessness and when our parents are coming out of homelessness, their stress level is still so high. So what we're seeing isn't even really accurate. It's not accurate information about developmental phases. It's not accurate information about who we're going to see in the future. And so we try not to make quick judgments about, say, developmental delays, when actually what we might be seeing is a stress response issue. Sometimes all we need is a month, a few weeks, even a few days to calm down the environment, to get kids into healthy rhythms, to make sure folks are seeing that safety is present and that we're reliable, safe people. And with that, we see development and behaviors and milestones kind of start to emerge on a more predictable timeline. So we do work hard on that. And we also make sure that, by the way, we're in congregate living programs, so we see the children every day, all the time, and they're also in our preschools. We also make sure that our observations are not a one-time thing that then kind of decides and labels this child in some way. So we make sure observations are kind of happening all the time. And we also make sure we're sharing them. So our evening house directors who live on the sites might be seeing behavior that they'll bring to the attention of the preschool or the case manager. We use a program called Slack to communicate, and it allows us to actually create channels that get people into the conversation. And it actually has been transformative for our agency since we started using Slack, because it means that you have a preschool teacher and the evening staff and the day staff having very specific conversations about the children they're serving together. We also make sure we observe kids in a range of activities. We want to make sure we're not just having a one-time kind of space where watching them in a classroom. We also want to make sure it's a really safe space, because oftentimes children, we might just be seeing something that's related to being slow to warm that actually isn't a verbal delay or anything else. So we're definitely trying to go out and play, go for a walk, go to the park, see them in the classroom, hang out at the house at night, get many different eyes and lenses on the child. All the while, we have a very long intake that we do ultimately fill out. It's just not a sit down, screen on and be done kind of process. All right, next slide. For our evidence-based kind of curriculum, the first thing I'll have to say is we design all our own curriculum. This means that we look at other sources of great information on development. We love evidence-based clearing now. So for example, if I have a house with that's skewing more towards moms that are about to have their baby, my curriculum is going to focus more on that period of pregnancy and the immediately postnatal period and that sort of thing. We also make sure that our curriculum, and I have this down at the bottom, we try to stuff in info less and dialogue more. So for example, if I have a house and if I see a young mother struggling with a 1-year-old that's just getting into everything, opening the cabinets, doing all the things 1-year-olds do, we might talk about Erik Erikson's theory of like initiative versus shame and doubt, or autonomy versus shame, and explain that lens of when children are 1, they're beginning to either develop a sense of autonomy and that their ideas are good ones, or they're developing a sense that their ideas get them in trouble and can be a source of doubt and shame. And we'll share that, and then we'll kind of talk with that parent about, hey, how are you seeing that? And rather than just having them fill out a worksheet or giving a lecture, they will quickly be able to identify, oh yeah, that's why they're, pulling the plug in the bathtub and tossing their food off the high chair. And we begin to normalize a lot of those behaviors and have conversations about what it looks like to build autonomy and minimize the impacts of shame and doubt as children begin to explore their world. We also, if I was going to point to a single curriculum, we love Brazelton's work. He's a pediatrician, and Touch Points is kind of the classic. What we love about it is his emphasis that development is not a straight upward line, but kind of an up and down journey, and that you see children have spurts of growth, but also fallback, and that those fallbacks are super common and to be expected and not to be seen as delays. And so we like the framework and the language he gives. We also just really believe that art is powerful, and letting parents scrapbook and plaster cast and write poetry and record lullabies and use arts to talk about parenting can be really powerful and leads us towards the same conversations we want to have as we go along. Next slide. Sorry, yeah, I think it's going the other way. We're regressing. Here we go. And finally, yeah, I just can't say, what it looks like to be culturally competent. It's constant work. I've been looking for our agency since it opened, and sometimes I read stuff I wrote back in 2002, and I'm just so thankful for my own growth and the way the staff has pushed us to continue the way we think about this work. I completely celebrate all the movements that are constantly pushing us to allow for more youth voice and to really look at the way like white supremacist practices and traditions might have influenced the way we teach things and think about things. So we have to be careful to really decolonize our parenting curriculum. There's whole conversations happening in the world right now about decolonizing parenting even, and for BIPOC parents to look at how some of the traditions have their roots in kind of historical generational traumas from past injustices. So we do actually spend a lot of time talking about this with our parents. We talk about how everything from the way you discipline to how you sleep and feed your child is how culture is passed from one generation to the next. We talk about how their parents brought them into their culture. We have brave conversations. We oftentimes will have a white mother with a BIPOC child. And we make sure that we're talking about that. What are their thoughts about how they're going to transmit culture, share culture, speak of their own culture and the culture of another parent that may or may not be present. One thing that drives me crazy is make sure you get rid of language that presumes that your parents are cisgendered and straight. We also run a TLP for LGBT youth, and we have many, many parents that are queer. And so just make sure you know that. Get the word mother and father off all your intakes. Parent 1, parent 2 does the job. Make sure you have lots of points of connections to culture out in the community. In Sacramento, we're just so lucky. We have a lot of really cool things that that parents can connect to. Black Infant Health. We have cultural. I'm blanking out on the word. We have like cultural competency counselors that cannot remember the word that connect with our youth, and we bring in those agencies. Like I said, we've brought in a lot of our grads to work in our agency and make sure we're doing that. And then finally, or two other things, make sure you blend your population. So like one of the most powerful things we do is we have the youth in our LGBT housing and the youth in our parenting housing. They blend daily. They're in the same room all the time. And it's transformative. We have our, you'll have, young queer youth helping hold babies and share. And then that builds so much understanding and so much authentic community. And like so much of the uplift and growth in our youth is because of those being in the classrooms together and talking about things together. And then finally, we have to name the injustices. We have to name that so much of who we are has been influenced by our privilege or our lack of access to it. And having those conversations has made our agency so much better. That's why things like co-sleeping, we have to make sure we don't just say they're dangerous. Many cultures co-sleep. They love their children. They don't do dangerous things. There's a great NPR article about how honestly co-sleeping is you're more likely to get struck by lightning than for a healthy baby to have anything happen in co-sleeping. And so we have to have sophisticated conversations about these things that honor cultural tradition while also keeping children safe and, to be honest, honoring, the FISBE guidelines that come down. We can balance all those things. Okay, I think one of my last slides. And finally, we really think that a lot of developing the parenting skills needs to happen with fewer worksheets and more play. So much of it is one-on-one. Food pyramid worksheet, but making baby food together, high impact. After a baby food making workshop, we see parents make baby food more often. One of the most impactful things you have to do is making sure you have, especially in those first 2 weeks after baby's born, people there around the clock. So if we have a parent that's hoping to breastfeed, we make sure that somebody can be there at 2 a.m. when that parent is just sobbing because you can't get a baby to latch and you're worried that baby is not eating enough, or you've got a doctor or a nurse telling you all of a sudden, we'll just do some sugar water and try the bottle. You need support in those moments, and making sure we're there and in those moments is so key, and that we give them permission to reach out to us in those moments. Also, a lot of people, and including your staff, have no clue how to play with the baby. We're pretty good playing with 1 and up and mobile children, but little newborns, we don't know what to do with them. And so there's really great books, like getting just books to throw all over the houses on baby games and how to play with babies is great. And to be honest, a lot of those baby games are all about attachment. And so instead of telling people attach with your baby, you can instead teach them games that help them attach with their babies. And I think that's about it for me. If anyone wants to reach out, we're happy to share information. I'll drop my email into the chat. And thanks for the opportunity to share.
Thank you so much, Bridget, for such a robust presentation. Thank you, Tawny, Laura, Lakeisha, Christine, of everyone that has presented. You all have given us such rich information that will be so useful as we move forward. And I definitely want to thank all of the programs that are in attendance. Even if you didn't present, programs are doing such strong work that is so important to moving a family to independency, resiliency, and sustainability. So just appreciate all of you programs. Please keep up the good work. FISBE is counting on you all. Definitely bookmark all of the different resources that you will find in the PowerPoint presentation, because they will be so helpful to you as you forge forward. And with that, I am going to turn it over to my colleague, my mentor, my spiritual leader, Deb Oppenheim.
Thank you, Nikki. It's pretty hard to follow up on that, but I want to thank so much the presenters from the programs, the maternity group homes, to Bridget from Waking the Village, to Laura and Tawny from Arizona Youth Partnership, and Lakeisha and Christina from Bridge for Youth. I also want to thank all of our wonderful RITAC partners, and I'm just delighted. A little shout out also to my mother, may her soul rest in peace, because there was a lot of information or discussion about empowering, and my mother always said, in talking about her grandchildren, power to the babies. So I am Deb Oppenheim from Region 9 in San Francisco. We are so fortunate to work with California, Arizona, Nevada, Hawaii, Guam, and the Outer Pacific. My colleagues in Region 9 are Patrina Winston and Angelica Gutierrez, who keep me on my toes Not always easy, since I am the oldest federal project officer, sometimes wander off into the good old days. We're happy to have Jeff Daniels as our program manager. As those of you who know me or have seen me in action around the young parents and their little ones when I'm on site at their wonderful agencies, I am a huge fan of maternity group homes. It will require all of my self-control to keep from playing Zoom peekaboo during this presentation. Forgive me if I slip up. So on to performance standards. Next slide, please. So they are used as essential components of measuring successful outcomes for the youth and the children served by FISV funding. We expect outcomes to be enhanced in accordance with the purposes of the RHY Act. That means that grantees collect data elements and report via the Runaway and Homeless Information System / Health Management Information System and program performance reports. Although it's true that performance standards for basic center, transitional living, and maternity group homes have many similarities, there are important differences which I will highlight. Next slide, please. The performance standards for maternity group homes, social and emotional well-being, and it's required that youth receive. Sorry, Sita, no, you are so not the oldest. It's important that youth receive trauma-informed care, which we actually talked about earlier, and social and emotional well-being in the context of a maternity group home means positive health, physical and mental, behavioral and dental, provide youth with substance abuse treatment, give training on personal protection and safety, particularly how to identify and avoid potential human trafficking and reduce sexual risk behaviors. Now I have a brief poll. I promise it's going to be brief. Can you put that up, please? This is about the young people and their how many have had the vaccinations for COVID. Where's that poll for COVID? Okay, evidently I don't get to do that. Okay, then. Next slide. Permanent connections. So this is true with the other programs also, that we enhance constructive, enduring connections to those who can be continuing supports in the lives of the young people. It's measured at exit from the MGH programs, and it's especially important because it harkens back to helping both the young parents and also the children. Now I have another poll here. Could we have this poll? Okay. Yes, thank you. So what I want to talk about, because there have been instances where it's hard to follow up with the young people, they're hard to pin down. So my suggestion is that you may want to contact somebody who is that permanent connection so that you can contact them to make sure the youth is doing well. If I could have a single choice, how many have done that? Yes. And those who have not, no. So, oh, that's fantastic. I'm so pleased. It's a great resource that sometimes we do not think about. Next slide, please. Education and employment. It's imperative that MGHs prepare the young parent to achieve self-sufficiency when leaving the homes. To do so, they'll need education and/or employment. Education means, or employment means, performance in and completion of educational and training activities. Among those, we need to make sure that they will receive training in interviewing and obtaining and maintaining jobs. And we have expectations in maternity group homes on how the successful outcomes, what the measurements will be. Next slide, please. Safe and stable housing. We want them to transition to a reliable place to call home. Stable housing fulfills a critical and basic need for homeless youth. It's essential to enable functioning across a range of life activities. As we discussed earlier, there's no one overarching definition. Many youth and their children will need to share apartments or reestablish links with families who will respect and help maintain them in their futures. We will be discussing childcare, child development, health, and well-being during breakout sessions later. But for now, Jessica will discuss sustainability. Take it away, Jessica.
Hi, everyone. So I am back again to, as my colleague Deb mentioned, I'm here to talk about sustainability planning. So next slide, please. And so as many of you all are aware, when you're writing an application for the competitive funding process, a really important part of the application is, it's small, but important piece is, developing a sustainability plan. And a couple of core aspects of that sustainability plan are, including a plan of diversifying funding, making sure that you have a staff retention plan and staff retention, ensuring, how you're going to address staff turnover, also staff recruitment, and then accountability and what your plan will be in holding, staff and the program accountable in meeting FSB's MGH performance standards, which the performance standards that Deb had just shared with us previously. And then finally, what would be the plan for collaborating with other local service providers? And so those are really the core aspects here of that sustainability plan. And so I think that now more than ever over these last few years, with the pandemic and everything, we've seen now that, folks have really had to take out your sustainability plans and look at, how are we going to implement this now? And so I think that also, the idea behind the sustainability planning is that as much as I would love to give tons of funding to everybody, and that could be the main funding from the government, I probably shouldn't have said that, but FSB funding is not intended to be, agencies only funding or funding to last forever. And so the goal is really that, agencies that you're diversifying your funding sources, that you're seeking out, that you're also partnering with other agencies in the community. So you're not the only game in town that's doing this kind of work. You have your piece of the area of like expertise and working with RHY, but then there's other agencies in the community that are, also doing kind of other elements of work with this population. And then, like I said, the piece in accountability and meeting MGH's performance standards. And then, the really important piece of collaborating, with other community organizations. So having that plan, so developing, existing partnerships, and then what will that future plan look like of strengthening those future partnerships and sort of maintaining those collaborations as well. So that's pretty much, what I have to talk about with sustainability planning right now. So I think I am going to go ahead and hand it off to my wonderful colleague, Danielle.
Thank you so much, Jessica. Wow, this training has been so full and resourceful today. I've loved hearing from everyone so far, and I'm going to dive into the last section that we have here. And again, my name is Danielle Taylor, and we're going to discuss the administrative and national policy requirements. Next slide, please. So, as we all know, background checks are required. If your project is unable to obtain the FBI criminal history information or child abuse and neglect registry information, your agency must plan in detail the efforts to obtain such information and the impediments to doing so. In addition, it is appropriate, or as appropriate, to job functions. Projects must also include verification of educational credentials and employment experience, the individual's driving records for those who transport youth, and professional licensing records. It's recommended that projects conduct background checks more than once throughout extended employment, every few years if possible, as there may be instances of unlawful or unsafe behavior outside of the workplace that your program may be unaware of. Also ensure that you review the scope of what your state background checks include. Some may already incorporate FBI checks, sometimes not, and often the sex offender registry checks are not included in state or FBI checks. So you want to make sure that you're hitting all of these target pieces and having that recorded in your staff files. Next slide, please. Emergency preparedness planning is another very important part of the requirements. Your plan should contain strategies for addressing evacuation, security, food, medical supplies, and notification of your client and youth's families as appropriate. In the event of an evacuation due to a specific facility issue, such as a fire, loss of utilities, or other significant damages from natural disasters, hurricanes, tornadoes, floods, depending on what your region experiences, an alternative location needs to be designated ahead of time and included in your plan. Your plan should be well documented and your staff should be knowledgeable of the plan. As we know, instances like natural disasters happen when you least expect it. So ensuring that all of your staff is ready to address these issues is very important. It is required for your it is required that your project and anywhere that you are regularly referring your clients, that you have evidence of any required licensures within your state or locality. Next slide, please. Next is the ever-loved training plan. Every staff is not necessarily required to receive training in absolutely every subject that is offered. However, all of your youth serving workers on staff should receive training sufficient to meet the stated core competencies of youth workers. And I'm going to go back to what Nikki was saying earlier and has been mentioned multiple times. Rhy is one of our greatest resources for these trainings. They can work directly with you, collaborate with you and your federal project officer, and ensure that you're constructing a training plan for all of your staff that sufficiently covers the expectations and needs of your staff. Next slide, please. Technical assistance monitoring and short-term training. Once again, Rhy. Have that bookmarked on your browser. Any other training resources that your program likes to use, anything that meets the needs of your team. Have that constantly at hand and ready to continue to build on the trainings that will develop your team and their understanding and practice within serving our runaway and homeless youth, and especially in the case of serving young children as well. Your training should be continuously planned, and the trainings that you must ensure you have funds budgeted aside for in your regular budgets are the national training that we put on, as well as the spring training like this one, and our regional based training that would happen at the same time of year. And to touch on monitoring, this includes, but is not limited to, virtual site reviews. We have developed and provided a training to prepare you and your program for a virtual site review when you are on the docket to have that completed. Next slide, please. I'd also like to touch on confidentiality. Confidentiality is very important to all of us as individuals, and it's very important to our clients and staff as well. So we want to ensure that you are doing your due diligence and making sure that any of your staff files, their children's files, are all protected, and that your clients have access when requested to see their files and amend any documentation that may need amending. Any records that you have out or posted, whether it's how many youth are in your facility at one given time, any personally identifying information should be safeguarded. And next slide. We're going to also touch on reporting. You can jump into the next slide. This includes RHYMIS, how we say that acronym, RHY, HMIS, monitors individuals as they experience homelessness and what services they've been provided and the outcomes of that, as well as your regular performance progress reports. These are required, and you will find your PPR schedule within your notice of funding, and the expectation of RHYMIS uploads is now quarterly. Perfect, thank you. To close out this section, we are going to have Nikki and Tim jump in for some Q&A. Thank you so much.
Thanks, Danielle. We are actually running a little bit behind, so we're going to skip Q&A, but if you do have comments or questions, please make sure they're going into the chat. We're going to take a 5-minute break right now and then come back to do our breakout sessions. But please make sure to not leave the Zoom room or log out of Zoom while we're on break. Leave that open still.
And just before we go, please know that the conversation does not end here. Reach out to your respective FPOs. Check out RITEC's website for the communities of practice, where you can pose a question and you will get answers and responses from programs all across the nation, as well as your local programs and states. So again, thank you all for all the strong work that you all are doing. We so appreciate it.
So we have a few minutes to kind of go over the high level ideas that were discussed in the breakout rooms. So we'll just go in order. We'll start with room 1. Are you there, Deb?
I'm here, Tim. Thank you. So we had a fabulous breakout in room 1 and actually learned a lot that we did not necessarily know before. So in talking about the collaborations, it's obviously incredibly important that the agencies were able to either start or maintain those collaborations. And if you want to hear about an amazing one in Wilmington, Alyssa, they partner with something called Smart Start, which provides all sorts of information to the agencies to help the young people hook up with the right kind of childcare. So that was amazing. But what you really need, you also need to be, first of all, a lot of the geographic areas, almost all of them, in order to provide any kind of childcare, there is an expectation that the young person be employed. So obviously, sometimes it's extremely difficult because they can't be employed unless they have childcare. So it's a difficulty. It's very hard. In terms of Head Start, that we heard from our group, not a single successful admittance into the regular Head Start programs. There have been some for early Head Start, but not for the other Head Start programs, which is incredibly sad. It really is horrible. So what Bridget and Waking the Village have done is that they have had to provide their own in-house childcare resources, and they now have 3 centers that provide both to the maternity group homes and to others. And because those in the other part of the population are able to pay for that childcare, that provides funding that allows these centers to continue and help the agency. So it's absolutely wonderful, as a lot of the people in the group talked about. Asia talked about how very costly it is, and there were some areas in Texas, interestingly. So the government has been able to provide some extra emergency funding during the pandemic, which has helped pay for childcare. And before I leave and let somebody else, I just want everybody to know, and RITAC has dropped this information, the HUD has just dropped the YHDP funding announcement. So maybe we'll be able to put that up in the chat, that link, because a lot of you have used that, and it's been very helpful in all aspects of your programs. So that's it for Group 1.
Thanks, Deb. In Group 2, we had Habiba. Can you let us know what
Yes.
y'all?
Got it. I meant to turn on the camera and the phone. Hi, can you guys hear me?
Yep.
All right. So we had an amazing conversation with Group 2. Group 2 rocked because we're just fabulous like that. So we were also talking about the childcare question. So we found out that Christy from a program in Las Vegas was able to help, their case manager was able to help a young person who was actually going to a childcare center to see about childcare actually get a job there and work to support that young person not only getting employed, but also getting connected with their childcare center. We talked about Dawn Tiegler told us about how her program has an amazing partnership with both Early Head Start and Head Start within the agency. So they work to ensure that all their families enrolled in the program receive Head Start and Early Head Start. So Debo, I apologize, but they do have an amazing relationship with Head Start and Early Head Start in their program. Ms. Battle talked about in Georgia that they are working to find different alternatives to for childcare. We know also, and I think also Christy also shared that for a couple of the programs, they're finding non-traditional ways of providing childcare, i.e. grandmothers or abuelas or somebody in the family that is watching the child that also serves to be a part of a permanent connection. So that's exciting. So the young person is connecting with their family again, and building a relationship and trust where they're allowing their family to watch their child while they go on to look for work and gain self-sufficiency. Carolyn Relford shared about how they are in the process of opening, I think in the next month or so, opening their own childcare center, developing a parenting committee to ensure that the childcare center is meeting the needs of the people, the needs of the young people, and how they took lemons and turned it into some fabulous, delicious, wonderful lavender lemonade. And that's what MGH grantees do. We take lemons and make lemonade. So I was really excited to hear about how all of the challenges that our grantees face, they took it and turned it into opportunities. So group 2, we rock. And I'll turn it back over to you, Tim.
Thank you, Viva. And on group 3 was Danielle. Yeah, Danielle.
Yes, hi, thank you so much. Group 3, we had an exciting experience of trying out some technology that may not be new, but it's new to me. And I have the feeling it's new to some of our participants as well, called a Miro board. So we will be sharing some of the results of that. Although due to our decreased time from all of the vast information that was shared throughout the presentation, we weren't able to make it through all of the questions, but we did have some great conversation and some great ideas popping up. In response to the first aspect, we've discovered that referrals for childcare are vast: early Head Start, family members, early childhood programs, and youth and young adults who are able to offer other referrals. We had a comment from Michelle with, I have to double check on what your program name is. I'm so sorry. Families First. Michelle with Families First shared that our youth in MGH programs are considered a priority grouping for childcare. So sharing that they are within an MGH program should bump them up to the top of the list for any childcare needs that they have. And they are eligible for CCAP childcare assistance funding. We discovered that these relationships are developed and nurtured through building trust and finding opportunities to make connections, taking that extra time with the youth to build those connections and with their families, engaging in outreach with organizations and youth is the most beneficial way to build these relationships and connections, just taking that time and having that conversation on a regular basis. So unfortunately, we weren't able to dive deep into how these collaborations have helped our young people pursue their goals, other than the known opportunities. When you have childcare, you're able to maintain employment and go about educational pursuits and other life goals.
Thanks, Danielle. And in room 4 was Tiana.
Yeah, thanks, Tim. So group 4, we had some good conversation about how, collaborations have been made in terms of childcare. So one of our colleagues in South Carolina actually mentioned something called a breakfast carpet, which was an opportunity located at the Chamber of Commerce there. And it's an opportunity for new businesses and other providers to network. So she found that really valuable in being able to look for services, not just childcare, but all types of services for young people in the program. We also had one of our colleagues in Kansas talking about a partnership that was just very fluid. So it was, they were in a building and the building is being shared by another local agency that actually provides childcare. So they, offered slots for their, young moms who, young parents that have children that need childcare. So it was a pretty easy, sort of partnership where you're sharing the building. So you have some slots left to the side. which is great. We also had a couple of folks talking about high schools, specifically for pregnant or parenting, young people that have childcare on site, which was very convenient. It also showed some increase in the bonding between the young people and, their children, because during lunch breaks or, breaks throughout the day, they can come by, visit, make sure everything's okay, and still, create that bond. And then we also talked about, young people who work at night or overnight and how, we sort of navigate that. And, one thing that's really promoted is young people helping out other young people. So their peers have been really supportive in providing sort of that, informal childcare, along with staff being present, for safety and making sure that they're supporting one another to really, increase that independence as they transition out to being able to, find other, parents that could help, and they'll also help with their children. So, really that partnering within the program as well.
Thanks, Gianna, and thank everybody that was in the first few groups there. It's really great to hear about, having these partnerships and these relationships in place. So that way the youth can come to the program and just already have these smooth connections there. We can go to the next slide, please, for question 2. And I think Nikki was in group. Yeah, Nikki, can you tell us about group 5?
Sure. Well, we talked about 2 curriculums. One was starting out right, which I think Laura presented on. I'm sorry, maybe that was Brigade in the presentations. And then another curriculum was parents as teachers that is used in some of the programs that were in the breakout room. Also, we had a discussion about wraparound services and support of MGH, assisting them in navigating the health system once in it, including providing medullas. There's a partnership with the Urban League for childcare vouchers, partnering with maternal and child health agencies for health and wellness services. And many of the programs have medical staff actually come in to present to the MGH clients prior to them even, delivering their child and throughout their pregnancy, so that they have already established that partnership so it's already developed when they arrive at the hospital, and they know who the doctors and nurses will be and all of that. And then we also heard about an assessment tool that is entitled ASQ or ASQ-SE, which assesses the child from 4 months to 5 years. And then the final thing was that we asked about how the pandemic has affected agencies. And one of the persons in the staff members in the breakout room said the pandemic was a gift in certain ways, because it actually made it so the city of Chicago provided each one of their clients with Section 8 vouchers. And that's it.
That's great to hear. Thank you, Nikki. Jessica, you want to share?
Yes, absolutely. So, whoops, thought I was on mute there. Okay, so, well, with group 6, we had a really great conversation. We started out, so a colleague from Michigan had actually shared from Alternatives for Girls that they will be using ASQs with the children, and then also the creative curriculum. And so that curriculum to be used with children is really focused on children, and their parents is really focused on teaching parents how to play with their children, as opposed to kind of other skills, but just placing that importance on parents really learning how to engage with their children at that level. And so next, we heard from a colleague from Minnesota who was talking about how she actually is engaging case managers in training about child and teen checkups. And so she had indicated she had sent a link to the discussion group about from the Department of Health in Minnesota. It's a web page that has actually child and teen checkup lists, and so it just indicates actually kind of a schedule of the vaccination schedules for small children, for babies, and then moving down to teenagers. And so she had indicated that this is something that is available for all states. And so that's something that could be a super helpful resource, again, for MGH staff to have available, so that they have this, information just at the tip of their fingers. And then from there, we heard from a colleague from Colorado, who actually asked a little bit of a different question and spoke about, engaging some of the young parents in the MGH program in participating in some of the skill building, life skills activities, because, and this is something that I'm sure a lot of programs see oftentimes, young parents come into the program, with their children who are very much like laser focused and, I want to get my job, want to get my education finished up. I, want to get this apartment, I want to get out, and I want to get everything stable. And then, maybe when it comes to participating in other activities that aren't, what they perceive as not something that's needed, it may not necessarily be something that, if they don't see it as something that's needed, they may not necessarily be inclined to participate in it. And so we kind of discussed, well, then what creative ways are we seeing other programs, what are they doing to engage, young parents that are, in the program to be able to do these other activities. And so we heard from various programs, that they are, kind of coming up with various sort of incentives. So we had, heard from a couple programs that they actually require MGH parents to attend groups, and so participate as a part of those workshops. And then, or they'll be able to get they'll participate so many times, and they'll be able to get some sort of incentive. Like, for example, they'll receive a punch card, and if they get so many punches on the card, then they'll receive some sort of a gift card, something like that. Or if they attend, so many activities, then they'll be able to go. I know this is specifically from Cocoon House, where they'll be able to go to the store that Cocoon House has, and they'll be able to get, nail polish or things like that the store has. So just some really interesting, like, creative ideas that the program had, programs had to be able to engage youth, MGH youth, to be able to participate in these really important and meaningful activities. That, the moment that they're in their lives, they're focused on, on some other things. And so I think finally, we were starting to have a conversation about programs, serving when they have a young person that comes in with a child, what about when they come with their partner? So what does that look like? What does that look like in terms of having housing available for both individuals, having that case management available for both of those individuals? If it's a mother, and a father, what does that look like in terms of the housing? So that was our discussion. And I think that, we had some really awesome sharing opportunities. So thanks, Tim.
Thanks, Jessica. And yeah, it does. It sounds like y'all had a great conversation. And I'll finish this off. I was in group 7 also discussing this question, and some of the assessments and screening tools and curriculums that were discussed that were helpful or successful for a lot of these programs was the Edinburgh postnatal screening, the A scale, and also having partnerships with external organizations that could come on site. So nurses and doulas that specialize in prenatal, perinatal services, having those relationships in place. and other general resources, not just for related to pregnancy, but also to early childhood development. Having those sources, meet the youth where they're at. So if it is a single site program, those programs having resources come once a week or something like that. Other things that we discussed related to wellness and well-being, having trauma-based art therapy, having projects for mommy and me type projects on site, and really just focusing on meeting the youth where they're at, like identifying what the youth is interested in, what are their goals, instead of just deciding for them what that curriculum will look like. Somebody mentioned the growth mindset for wellness, which that was pretty popular. We also talked about supporting accessibility to things like vaccinations. And we also talked about a need for more research-based and more recent or more current parenting and early childhood development curriculums. So with that, I am going to pass it to Kendall Arthur at Rhy Tech to discuss the next slide. And there's the next slide. So take it away, Kendall.
Thank you, Tim. As Tim said, my name is Kendall Arthur. I'm a training and capacity building manager for Youth Collaboratory and Rhy Tech. Before I hand this over to Dr. Dean for closing comments, we at Rhy Tech just wanted to take a moment to please ask you to complete this evaluation. My colleague has posted the link in the chat. Please provide as much feedback as you'd like. Rhy Tech and FISB both use this feedback to help us craft the trainings that you would like to see. So this is really where you can help format the trainings that we provide. We will also be sending this in an email soon as well. So if you do have issues using that link, you can let us know and we will help you try to resolve those issues. You can also view all of our upcoming trainings on our event calendar at the Rhy Tech site that Benita just dropped in the chat as well. After Dr. Dean's comments, we'll close out with How Far I'll Go from Moana in celebration of the fact that there's no telling how far the young people you have served or their children will go in their lives. So finally, I'll proudly introduce the director of the Division of the Runaway and Homeless Youth Services, Dr. Sanzana Dean.
Thank you very much, and good afternoon, everyone. Again, I'm Sanzana Dean. I'm the director for the Division of Runaway and Homeless Youth. As we close out today, I just really want to take a moment to thank you for joining our training today. As I've mentioned during previous trainings, FISB developed and designed this 4-part training series in response to feedback we received during the 2021 new grantee orientation. In the evaluation, our grantees noted a need for a deeper dive on program requirements and specific strategies for serving young people in their programs. So as Rhy Tech mentioned, we do listen to you and we always look for ways to offer new and engaging training resources. As this is our last offering in our program-specific training series, I really, truly hope that you found the content and the format of this training to be useful in building knowledge about program requirements or gleaning information and new strategies from your peers for implementing your own maternity group home program. It's important to note that if you were not able to join the other trainings, the slides and recordings will be made available so that you can go back and continue the learning for the TOP, Basic Center, and street outreach programs. A lot of great content was shared and a lot of new information and feedback is available to you there as well. I've really enjoyed being a part of the sessions over the last 2 weeks and the breakouts as well today. As I mentioned on Tuesday, I continue to be proud of the work that you do every day in supporting young people who are experiencing homelessness. This work is so important for many reasons. One that really resonates for me is an understanding of how the services provided in the MGH program benefit not only the young person, but their child. It's evident in the conversations that I heard and listened to today that you all really understand the importance of creating those nurturing parent-child relationships and how the strength of those bonds builds confidence in young parents, and how it has an overall positive impact on generational health and well-being. I'm so glad to hear all of the feedback about teaching young people how to play with their parents and kind of rethinking the way young parents have been taught from a cultural perspective about what is right and what is appropriate, to really allowing them to build and be a part of that process. And so your passion and commitment to the work that you do is evident from the robust discussions, the sharing of resources with your colleagues, and really all of the ways that your programs presented, that you go above and beyond to develop resources and supports for young people, the way you build partnerships in the community to continue to support these young people. And so I tell you, with over 20 years of experience serving children, youth, and families in a variety of capacities, I never tire of hearing participant success stories and how grantees and communities are supporting young people and really giving them the tools that they need to support them and to be successful. And so I'd like to thank all of our grantees who dedicated their time to not only join the training, but also those of you that presented and for your willingness to share your best practices and strategies with your peers around the country. I learned a lot about who you are, what you do, and what the work that you do means to you. And that means a lot to me as the director of this program, specifically someone who feels very fortunate to do the work that I do and have done for many, many years. So thank you for that. I'd also like to thank Associate Commissioner Waller for welcoming and opening the session and sharing a little bit about FISBE's priorities that guide the work that we do. Thank you to the RITAC team and Youth Collaboratory for your continued support of our grantees. I understand and saw that several resource links were provided in the chat. I encourage you to visit the RITAC website as well as the Clearinghouse website for any additional information or resources. And lastly, but not least, I'd like to acknowledge the tremendous amount of work that went into planning and developing this training over the last several months. To the RHY team and the MGH working group, I really appreciate your vision, your energy, and the creativity you brought to this training. I really enjoyed seeing all of the team personalities emerge throughout this planning process. It was a really nice touch on the Disney soundtrack, and I was actually singing along to, I think, all of the songs that were played during the transitions and the break. With that, I will close today's training with a sense of gratitude for all that you do, and to communicate to you that we are here from the FISBE team, the RITAC team, your federal project officer. We're here to support you. And feel free to reach out to us anytime you have a question, if there's anything that we can do to point you in the right direction, share any resources with you. I look forward to the opportunity to visit many of your programs in the coming year and to continue to learn about what you're doing. With that, I will say thank you. Please complete the evaluation. We look forward to hearing your feedback. I wish you well and enjoy the rest of your day. Thank you all.